Hello and welcome to Part 4 of the Dental Expert Advisory Series. My name is Ken Harlan with Ozarks Capital Funding, and today's topic concerns the intricacies of buying and selling dental practices. I have the pleasure of speaking to a couple of real pros in this area, Reagan Rodriguez and Carl Swanson of Rodriguez-Swanson, LLC. Gentlemen, thank you for joining me today.
Yes, no, you're welcome. Glad to do it.
Okay, well, Reagan, how about telling us about your company and the various services you provide?
Sure. Well, we're a merger and acquisition firm, and our niche or our focus is in the dental and the veterinary industry. And to give an example of kind of what we do, and I'll give the example of using a dentist since we work more with dentists. Let's assume that a dentist is ready to retire and he would like an exit strategy but maybe does not know what his practice is valued at. We will do a valuation to see what the practice is valued at, and then we find a buyer and connect the two. We also then find financing for that buyer and assist both the seller and the buyer for a smooth transition for that existing dentist that is now wanting an exit strategy.
You've been asked to find a buyer for a practice. What general steps do you follow to find the right fit?
You have to realize our buyers are people that have gotten out of college maybe 2-3 years ago and are maybe working as an associate. And, I mean, there's really no list or anybody that we can contact. That's not what we do. So once that listing is on our website, our buyers find us by going to Google. They will do a search. They'll hit dental practices for sale. They see ours. They fill out the section on our website that says buyer registration. And then from there, the process flows. But the type of people that buy dental practices are people that just got out of college 3-4 years ago. They probably don't even have a home phone number. To answer the question, we do nothing other than our website has great search engine optimization that finds them. Carl, do you want to add anything to that?
Yeah, I would say that it's not something that we do specifically to find a particular buyer for a particular practice, but one thing that we do like to set up is we've gone in and talked to several dental schools and students and things like that through lunch and learn programs, and so it's not something that is specifically finding a particular buyer, but those students, as Regan was saying, they're 2-3 years out of school, if they've heard us come in and give a little instruction or speech about the dental buying markets and stuff like that, that's somebody that automatically thinks of us and then comes back to us. And so it's we actually right now, I don't think Regan mentioned this, it's actually we're at a point where we have more dental buyers than we do sellers. So our pipeline of dental buyers is usually pretty full.
A follow-up question to that. I'm assuming that a lot of sellers, even though they're motivated to sell, are pretty picky about who they are going to allow to come in and carry on their name.
No, they're not. Your buyer's going to come when it comes. Don't expect us to send you a buyer the next day. And it isn't unheard of that we've had someone that calls and say, did you find someone? Well, again, as Carl said, we do have more buyers than sellers, but it's really up to that buyer whether they want that location or that particular practice. For example, we're dealing with one that is a dental implant practice. Well, there are a lot of buyers that don't have experience in implants. It turned out that we found somebody that specifically was looking to acquire a practice that did implants, and so it's a good match. But to answer your question, I don't think so. I don't think most of them are picky. Carl, correct me if I'm wrong. Do you think most of them are picky?
Not in most cases. Sometimes they will be, depending if when it goes through the negotiations and the transition period, if that dentist that's currently practicing is going to be on for longer than 6 months to a year, yeah, then it comes down to a little bit more of how the personalities work together and things like that, because there's going to be some extended period of time where they're going to be working together. But if it's just a kind of 3-month transition period, then it's not usually an issue.
When an owner of a dental practice is ready to sell, establishing a fair and accurate sales price is a key element. You mentioned earlier that you help them arrive at that number. Do you have an in-house staff that helps establish a fair market value for the practice?
Sure, I'll talk a little bit about this. And then, Carl, if there's anything that you'd like to add, we do a business valuation, and it's a very well done valuation. And I'm being biased not just because I own the company, but because I know that the different lending institutions that we've worked with and different banks that have seen our valuation feel that it's right on target, and based on our valuation, they're willing and able to lend the money based on our valuation. I don't know if, Carl, do you want to go into maybe going over just quick one or two specifics of what the valuation is and what it's not?
Yeah, I wanted to definitely make a point on the difference between an actual fair market valuation and an appraisal. A lot of times, sometimes a dentist, especially if they own their office building, will actually go to their realtor and ask about the value of what the practice in the building and things like that might be, but obviously it's more than just a real estate transaction. So a realtor is going to go in and they'll give an appraisal on the building and the land and things like that. Or sometimes they go to just their general business accountant or CPA and ask for a valuation. But it's really, when we've had to come in sometimes on the back side of things, they've already seen their accountant's valuation of what the practice might be, but it's really going to be totally different once we go through it, because we know what the bank is wanting to value the practice at, and we know what the bank is willing to finance the practice for, I guess would be the best way to say it. There's a lot of things that go into our valuation with the equipment, the patient list, goodwill, all kinds of different things that go into our equation. But it has, so far for us, it's always come back that our valuation is the one the bank likes to use. So